Welcome back. Dr. Wilbur is with us, and he's associated with the Mountain Home Christian Clinic. Welcome to the show, sir.
It's my pleasure to be here. I always love an opportunity to talk about Mountain Home Christian Clinic.
Well, let's talk about it.
Okay.
You got started in this how many years ago?
11 years ago.
11 years ago.
Time passes fast.
Now, was it your passion, or was it a group of people that started this?
Oh, it was a group of people. Started after we'd gone on a mission trip to Brazil. And when we came back, we thought about it and realized the people in Brazil had the same kind of problems we knew people did here.
Yeah.
And that weren't being cared for here. And so we thought we ought to do something about that. Out of that, the Mountain Home Christian Clinic came into being.
Did you have a pattern that you followed from somebody else, or did you guys
pretty much start out by ourselves?
And people have followed you, though, right?
Well, they have.
Okay.
We've been very fortunate to help several other communities start free clinics.
I was going to ask, you mentioned that you help people in Brazil. You would think that American has so many programs to help people, but that's not the case, is there? Is that what you found out?
Well, in Mountain Home and in everywhere else in the United States, in fact, if you have money or you have insurance, you can get excellent medical care, especially if you have government, support. But if you don't, you can find yourself completely left out, not able to get any kind of care. And those people exist everywhere, even in Mountain Home, as well off as most of us are here.
Yeah.
So those are the people that kind of fall through the cracks, the poor that aren't covered by Medicaid and Medicare, and those, so what they call the working poor often?
Well, mostly these are just people who are on hard times.
Okay.
Lately it's been people who've lost their jobs, it's been people who can't afford insurance, and medical care is expensive. Good medical care is available, but it's expensive. And if you don't have any money, it's a real problem for you.
Do you find
we try to meet that need.
Do you find that it's a temporary situation for most people?
Of the largest group we see, it is. But we also have a number of people that they're chronically in need.
Now, what services do you guys offer?
Well, we provide health care. Now, we provide health care in many ways. We limit ourselves to health care intentionally because there are a lot of good charitable services available in Mountain Home, and we stick to health care. So we provide basic primary health care in the form of dental care, in the form of medical care, in the form of eye care. We do counseling, we do support, we provide medications. Generally anything that has to do with health care that you can't afford, we try to provide.
And that brings up a question, how is it funded? I mean, this is a free service to people, of course.
Everything we do is free. Mountain Home is a wonderful community. It is a generous community, and it supports a number of charitable organizations very well, and it supports the Mountain Home Christian Clinic very well. And we're primarily funded locally. We do have some grants, we do have some supporters outside of Mountain Home, and we'll probably get a chance here in a minute, we'll talk about that just a little bit. But most of our basic support comes from good old community people right here in Mountain Home.
Now, you're open not every day.
Well, we are not open Saturday and Sunday, but we're open 5 days a week.
Okay.
And 4 clinic nights a month.
Why do you have clinic nights? What's the need for that?
Our basic service is provided through medical clinics. And in those clinics we have all the care I talked about. And we have volunteers, both professional and lay people, who provide that care. And we do that through those nighttime clinics. Originally when we started, we had 2 nighttime clinics on the first and third Thursdays of each month and provided general medical care. Now we have those clinics, but we have a specialty clinic providing primarily diabetic care on Tuesday nights before our Thursday night clinics. Then we see people for support and medication 5 days a week in our clinic. Sometimes we provide medical care during the day as well.
Now, has that increased from what you used to do years ago?
From the very day we started, we have grown both in quality and quantity of the service we provide. It's been amazing. You'd think we'd finally get to a place where we are full, but we just keep doing more and we keep providing more and having more patients.
Yeah.
What's your coverage area? I mean, like if someone comes in and says, well, I live in Stone County or Marion County, is there someplace else you send them, or do they stay here?
We have no geographic boundaries. Okay. Our limitations are need. Because the need is so great, we do have to limit it to people who do not have any medical insurance, people who don't have Medicare or Medicaid, and then I also say people who don't have money. and we use 125% of the federal poverty guidelines for a cutoff point with money. So if they're going to have service at our clinic, we see anybody the first time that comes or anybody that's sick. But after that, they have to sit down with one of our counselors and prove that they need their care and prove that their income is less than 125% of the federal poverty guidelines, which is about $12,000 for an individual and $14,000 for a couple.
So that's where's the clinic located? For the people who are sitting at home going, well, where is this wonderful place?
We're 421 West Wade Street, which is on 62 West, 2 blocks north of the college. You turn right, and right down the street you'll find the Mountain Home Christian Clinic.
I have a question. I had a student actually that I sent to the Christian clinic one time because she had a child who needed prescription vitamins. And I told her, got the address and everything and sent her over there. But her baby was having some sort of seizure. So can you help with things like that? I told her to go over there and ask. I said, they're wonderful people. If nothing else, they'll send you where you can go.
If someone needs care, we will. But if there's anybody else in town or any other way to get it, we refer them to that.
You refer to them. But you are a starting point.
We are a starting point. Okay. And many people come to us. The patients you admitted, you mentioned, there is wonderful health care in Arkansas for children.
Okay.
The Our Kids program works well, and we would have sent them to a local pediatrician, or if they just needed vitamins, we'd have probably provided them.
Okay. But so at least there's a jumping up, because oftentimes people, they don't know where to go, which is why oftentimes they wind up at a church somewhere.
Well,
so do all the churches in town know about you and know to send?
Oh yeah. A lot of people know about us and send folks to us, and we send folks to them too.
Okay.
It's a pleasure to do that. We work with the other groups pretty close, and we're well supported by a number of other organizations.
Is there a need that you would like our viewers to know about? Is there a shortage of anything, or?
Well, we are fairly wonderfully supported, but there is something I would like them to know about.
Okay.
Todd Gilbert has an insurance agency in town, and he noticed from one of his insurance agents that insurance company was celebrating their 100th anniversary. And at their 100th anniversary, they decided that they would donate some money to charity as a part of that. And they allotted $200,000 to do that. And they decided to pick out 100 charitable organizations over the whole United States and give each one of them $1,000. And Todd Gilbert brought that to us, and we really didn't think in the whole United States we'd have much chance. But we went ahead and filled out the form and told them our story, and they sent a representative to see us, and lo and behold, we got selected for one of the 1,000, and we received a $1,000 designated gift from them. Well, then they said, we've got another 100,000, and we're going to give 4 clinics, or not clinics, but 4 charitable organizations in the United States $25,000 based on how they can be voted on by members of their community. And so they have a game or a program or a deal where for the 100 days starting July the 1st in honor of their 100th anniversary, you can go on the internet and you can vote for your favorite charity. And the 4 charities that get the most votes will get those $25,000, which will be undesignated that we could use any way we needed. And those are the kind of funds we need the most. I thought we would not have a chance, it wouldn't be anything, but we got started on it. And from the very first day, we're in the upper group in that.
Is that right?
We have an excellent chance to win one of those 25,000 because people in the community support us, and there are people all over town that are voting. But anybody else that wants to vote, it might be 1 or 2 votes. You can vote one at a time every day through any computer that you have, and it's EMC Insurance, and their web address is COUNTON, COUNTON, EMC.com.
COUNTONEMC.com.
COUNTONEMC.com, which is not too hard to remember.
Right.
And if you'll go to that, there'll just be a couple clicks and you'll find where you vote for the Mountain Home Christian Clinic. Then if you put that on your favorites list, all you've got to do every morning is click that favorites list and then hit the vote.
There you go.
And you can vote every day for the rest until October the 8th.
And I'm sure you voted today.
I voted today. I voted yesterday.
Yeah, well,
good deal. Good. Well, that's great because, we're kind of at a disadvantage because some of these organizations are probably in a bigger community and
Many
so-
of them are community-wide organizations, and they're fairly big, fairly organized charities that come from large cities.
Yeah.
And so, who would think Mountain Home would be in the running? But we
Sure.
are,
You got great people here.
because Mountain Home's got great people.
That's it.
Absolutely.
That's
And
it.
it's hot, and they're all home clicking on their computers.
Oh, I didn't know there was anything good about being hot.
That's right. They're not on the golf course. They're not on the tennis courts. They're not even on the lake.
There you go.
Exactly.
Uh-huh.
Stay home in air-conditioned comfort and click your computer.
You bet.
That's
Mhm.
it.
You bet.
And that website, let me write that down.
It's Count On
Count on.
EMC.com.
.com. Everyone at home, write that down and make that a point to vote at least once, please, at least once.
Or every day.
Every
Every
day.
day. Every
Once a day.
Just
every
one
day.
or two more votes might make the difference.
It
Well,
might.
if it's 100 days, it'll last, 3 months?
Until
so
October the 8th.
October the
Yeah.
8th. Very good.
Well,
Keep
good
on
luck
voting.
to you, Dr. Wilbur.
Thank you.
Appreciate you so much for coming by, and it's a pleasure to see you again. And it's a pleasure for us to honor someone here on the show that does great work, and I'm sure what you do is very fulfilling.
Well, thank you. It's my pleasure to be here.
Thank you so much. And
You bet.
please come again.
Okay.
All right, up next, we're going to go to the dogs, I guess, and talk with Barb and Betsy and about an obedience and rally trail. Stay with us.